Greetings everyone, I'm Dr. Cesario from Neocare Clinic and Fertility Center here in Mbarara. I'm privileged once again to share with you about issues of infertility and what we are currently doing for our patients that are facing this burden of infertility. In the previous episodes, we've been describing what infertility is, what causes infertility, and so forth and so forth. Today, I want to share with you a little experience of what we've gone through as Neocare Clinic from the time we started treating infertility up to the time now when we are registering pregnancies. I want to celebrate with everyone and with the Neocare team and with our patients for the very first delivery that we had from our own efforts and from the fertility technologies that we use here. We recently delivered a bouncing baby boy. This is the very first baby that we've delivered from all these mothers that we've been treating for infertility using IVF. IVF is in-vitro fertilization, where we fertilize the egg and the sperm in the lab. I've been describing this. And yesterday, but one, we were lucky that our very first patient delivered with us, and we got a bouncing, healthy baby boy. And we are very excited about this. We are very happy. Neocare is very happy, and the community at large is very happy. And briefly, I will tell you that IVF is a rigorous process, okay, for both the clinic, the clinicians, and the patients. But we are happy that finally we are able to register this. Patients go through assessments, they do a number of tests, then the treatment itself takes some 1 to 2 weeks of daily injections. Then our lab team spend like 3 to 5 days trying to fertilize these eggs and making embryos. And then we transfer these embryos back to the mother. And now once this is done, these mothers undergo supportive medications for 9 months. They go through antenatal times, they do antenatal visits for 9 months. And we are happy that all this has been done, and we are finally celebrating our first birth. We have a number of women who are currently pregnant at different stages of their pregnancy, and in fact next week we will be delivering another one, and so forth and so forth. And what we want to tell the public is that things now are possible. Even people who are aged beyond 40 years, through our IVF technology, they can conceive and have children. And the current mother we are talking about is 49 years old, and through IVF she's able to realize her dream of mothering a baby. Even us as Neocare, we are very happy, and as a region we are also very happy. This is a service that has been accessed through long distances traveling, but now people can access it here in southwestern Uganda, specifically in Mbarara. We know the investment is very huge. A lot of resources are required for such labs to be set up, for such treatments to be set up. Even for patients, we know a lot of money has to be paid for this service to be accessed and done. But we want to still celebrate that all this is possible. We've invested, patients are able to access this service, and we have a huge team of specialists that are able to do this service in our midst. And we want to tell the public that people who are out there who think they don't have options, who think they are already aged, who think that all the options have been exhausted, they can still try IVF and have babies. And these babies are as normal as any other baby that was conceived through natural means. The process is completely natural. Some people are worried, they think because it is artificial, therefore these babies are different. There are no abnormalities. The only thing is that we are aiding the natural process to take place, that is fertilization. And therefore people shouldn't be worried about IVF. Some think that it is very invasive, requiring doing surgeries on them. No, it is a less invasive procedure. Simply get injections. We pick an egg, pick a sperm, using tiny needles, and then after making a baby, we take it back to the mother's womb, and then look after this baby until delivery. And the process of giving birth is also as natural as any other woman who conceived naturally. It can be normal delivery or cesarean section, although we prefer elective cesarean section in this case, so that babies are not exposed to any dangers or risks that are associated with labor. Okay, now going back to the details of how IVF is done. There are about 5 stages that we go through. The first stage is stimulating a woman's eggs. We know every month one egg is able to grow on its own in a woman's body. But during IVF, we want a good number of eggs to grow. So what do? We subject these women to injections every day for about 12 days. And these injections, called gonadotropins, are meant to stimulate their ovaries so that they grow a bigger number of eggs. And our target is usually 10 eggs, 15 eggs. And that is good enough. And why the many eggs? Because we want to maximize chances. All these eggs usually do not get fertilized or form babies. So the more the eggs, the better the chances of getting a baby. Now, as women undergo these injections, they also undergo monitoring. We have to monitor these eggs, how many of them are growing, at which pace are they growing. And we do ultrasound scans, we do blood tests in trying to monitor the response, and we keep changing the doses as well. And that's what we call cycle monitoring. Now, around day 12, when eggs are about to mature, then we go to the third process called egg pickup or egg retrieval. This is a simple procedure that we do from a theater. Women are given simple anesthesia, that is simple sleep, and the process is painless. Then through a tiny needle and with the aid of ultrasound scan, these eggs are picked up. At the same time, when we are picking up the eggs, our team of embryologists are in the lab to receive these eggs. Once they receive these eggs, they analyze them for quality and numbers, and then fertilize these eggs using the partner's sperms. Those sperms are provided on the same day when we are picking these eggs. Now, after fertilizing these eggs, the next step is to monitor for fertilization and also cell division, that is formation of the baby. At that time, it's called an embryo. So usually within 3 days, we are able to tell that this egg is fertilized and has formed an embryo. Sometimes we go up to 5 days. Now we choose now to transfer these embryos to the mother's womb, and that is the next step. This time the mother doesn't have to undergo sleep because it's completely painless, it's less invasive, no surgery involved. We simply use a soft tiny tube called a catheter to pick up these babies called embryos and inserting them into the uterus of this mother. Okay, and that is what we call embryo transfer. Now this can be done on day 3 or day 5, depending on what the lab decides. Now we usually transfer about 3 to 4, depending on the mother's age. Those who are older than 35, we tend to give them more embryos, but those that are younger than 35 years, we give them fewer embryos because we know their success rates are higher. What do we do with extra embryos in case many eggs were fertilized? We keep them. We freeze them in a process called vitrification, and we store them in liquid nitrogen at a temperature of -196 degrees. And these embryos are able to safely stay there for even up to 10 years. So in the future, in case this mother or this couple wants another baby, they already have the embryos kept, so they don't have to go through the other process of injections. We simply prepare them and then we give them these embryos. Now, after that, we have to support these embryos that we've implanted in the womb. That is the fifth step that we call luteal phase support. A number of drugs can be used, progesterone, estrogen, and then for the next 2 weeks after embryo transfer, we monitor this woman and we keep her on these drugs. 14 days later after embryo transfer, this woman comes back to our clinic for a pregnancy test. And this is a blood test and a urine test. And in case this test is positive, then we say the process was successful. In case it is negative, then we know the process was not successful and we prepare her for another cycle of trial. I told you that the success rates of this process of IVF range between 25 and 40%, meaning there is a failure rate and a success rate. Now, many factors determine whether someone is going to be successful or not, and age is one of the factors. Young people below 35 years tend to be more successful than those that are older than 35 years, and this is to do with the quality of the eggs, quality of the embryos, and also the ability of the body to support. And our labs usually do everything in a perfect manner to maximize the success rates. Now, this marks the end of IVF cycle, starting from stimulating the eggs, picking them, fertilizing them, and then transferring embryos to the mother. Now, for those who succeed, we monitor them. We monitor their pregnancies up to about 12 weeks, that is 3 months. At that time, we are sure that this pregnancy is competent and is able to continue like any other pregnancy. And at that time, we subject them to the normal routine antenatal care for the next 9 months. Now, for IVF patients, we tend to deliver them by elective cesarean section at 38 weeks. That is after completing 37 weeks when the baby is mature. We usually take these as precious pregnancies, precious babies, and we want to deliver them through a less stressing procedure, that is cesarean section. And like I said, the outcomes, the babies born are the same as the babies that are naturally conceived. Many people have they have misconceptions, misperceptions about this process. They think these babies maybe will be different in the future in terms of intelligence, in terms of health, but I want to assure you that nothing is different. This is a baby that was formed from a normal egg, a normal sperm of the parents. Right now we are going to talk about reasons why some couples or some people need to do IVF as their only way of getting a pregnancy or a baby. Now we know in the natural way, there are about 4 things that must be normal for a natural conception to take place. And I usually describe this in my previous episodes. For a man, we need normal sperms. And what do we mean by normal sperms? They are normal in number and quality. And by quality again, I mean sperms will have normal shape, they have energy to swim and move, and there are so many things we check when we are doing a sperm check. So with men, we usually do a sperm test or a semen analysis and look at all these parameters. And we usually want to say the sperm test is normal. And once that is normal, we assess the woman. Okay? So the female spouse undergoes a number of tests. We want to look at her uterus. Is it normal or not? So we do ultrasound scan for that. Then we assess her tubes. And we know sperms and eggs usually meet in the tubes. And therefore these tubes must be normal, they must be open, so that there is free movement of both eggs and sperms and they are able to meet. We do a tube test, number of tests that we do for that. We also assess her eggs, okay, especially people who are aging up beyond 35 years. We know naturally eggs start reducing in numbers. So we have to do what we call ovarian reserve tests. How many eggs are still there? So that we can do on ultrasound scan and by measuring some hormones in their bloods. So having checked the woman's uterus or womb, having checked her eggs, having checked her tubes, then we declare her normal. Once we have those normal parameters in the woman and the man's parameter of sperm test is okay, then the rest will depend on the timing of intercourse. We know ovulation takes place usually between day 12 and day 16 for most people with a normal cycle. So for couples who don't stay together, they have to do timed intercourse during that time. Okay, and for those who stay together, you simply need regular intercourse of about 3 times a week. And if intercourse is also normal with no difficulties, men don't have erectile dysfunction and sexual difficulties, women don't have sexual difficulties, their eggs are normal and ovulating normally, usually there is a 25-30% chance of conception or of pregnancy every month. Okay? Now, if there is any problem with the 4 requirements that I talked about, then we start going into what we call assisted conception. Okay? Helping these people to conceive. If tubes are blocked, automatically these people need to come and do this procedure of IVF. Okay? That is one reason why some couples must do IVF as their only way of conceiving. If we checked the husband's sperms and found that they are suboptimal, meaning they are not adequate to achieve a natural pregnancy, then we assist these sperms using our assisted techniques in the lab. So again, this is through IVF that these couples are going to conceive. Now there are many other parameters also where someone has everything normal and other treatments have been done. Apart from IVF, we can do ovulation induction drugs and then tell people to have timed intercourse. We also have artificial insemination or IUI, where we pick sperms and directly put them in a woman's uterus at the time of ovulation. So if all those procedures have failed, then the ultimate procedure that they are going to do still is IVF. So the 3 commonest reasons why people must do IVF, number 1 is having blocked tubes, and in Africa and in Uganda in particular, tubal blockage is the leading cause of infertility. Okay, so a good number of people out there only require IVF for them to succeed and conceive. If we have men with sperm problems, still the only way to go is IVF. Okay, and now there is another aspect of advanced woman's age. If women are growing older than 35, we say they are having advanced age, and that has an impact on the number and quality of their eggs. And when they reach 40 years, their eggs are almost completely finished in their body and they undergo what we call menopause. So if we find women at that age, their best way to conceive still is IVF. Okay? Now, there is that category where women completely come to you without an egg in their body, and they have to use an egg donor. Okay? So the process of getting an egg from a donor, fertilizing it to make a baby, and putting this baby into a recipient, or this woman who is in need of conception, has to be done through IVF. Okay? Some people, for a reason or another, they have their eggs finished before they even reach the age of 35. We call that premature menopause or premature ovarian failure. Still, these people will need IVF. Again, we have men, for one reason or another, they have no sperm at all in their body and they can't manufacture sperm in their body. They also have to rely on a sperm donor. And that again will be through IVF. Again, some men may make sperms, but for a reason or another, these sperms are unable to travel from the testis and to be ejaculated. So there is a blockage in the man's tubes, so that sperms are held down. And these sperms can only be used if they are picked directly from the testicles and injected into an egg. Again, this has to be through IVF. So as you can see, there are several reasons why couples have to opt for IVF or in vitro fertilization as their only way to succeed in getting a conception. We also have situations where we have embryo donors, okay, where a woman can't have an egg, a man can't have a sperm, but this couple needs to have a child. Then we have to adopt an embryo from someone who has embryos to them. Again, this is through IVF. Okay, now we have other things that we call third-party conception, where we use surrogate mothers. A woman, for one reason or another, may not be able to hold a pregnancy. Maybe her uterus was operated on and removed, or it is structurally unable to carry a baby, and they have to use another woman's womb to carry their pregnancy. That is called a third-party conception or surrogacy. Again, this is part of IVF. Now, there are these people who keep getting recurrent pregnancy losses, recurrent miscarriages. Someone comes to you, 3, 4, 5 pregnancies are all ending in miscarriages or abortions, and they don't know what's going on. These are people that also need IVF. The other beauty with IVF is that we can check these embryos to see if there are any abnormalities in them before we transfer these babies back to the mother's womb. That is what we call genetic screening, okay, or pre-implantation genetic testing, PGT. So this helps us to know if these babies have a problem. Now, there are also these people where you find in their family there is a disease that is inherited from the grandfather or mother to the children and to the grandchildren, and it is clearly known, like sickle cell disease. Okay, now for such people, you know, usually the chance of having a sickle is about 50% in case one of the partners is a sickle cell carrier. So in such a case, we make babies in the lab and check these embryos to see if they are carrying that gene of that disease like sickle cell. And if we find embryos that are free from that gene, we give them to the mother, and those that are carrying the problem, we don't give them to the mother. Again, that is through IVF. Now, there is what we call fertility preservation. There are people who undergo treatments in life, or they get diseases that may render them infertile. Okay, for instance, someone may have a cancer of their ovaries, and in ovaries, it's where we have eggs. And you find the treatment is to either destroy the ovaries or cut the ovaries completely out. And these may be young people who have never conceived. So what do? We stimulate these ovaries, pick these eggs, and keep those eggs in our labs, so that in the future, when they have recovered from cancer, they can still have a chance to bear a child through their stored eggs. The same thing with men. We can store their sperms in case there is something that is going to destroy their sperms, like treatments or cancers. And in the future, they can conceive a baby using their own stored sperms. Okay? And all this is possible through the technology of IVF. So many reasons, and I hope from the list that I've given now, people can see that IVF is one of the technologies that is very, very necessary, okay, for the community and also for us as health workers to preserve fertility. And we know in Africa, having a child is something that every society needs, every family needs, every individual needs. So doing all it takes to help couples have a child is our work as Neocare Clinic and Fertility Center and several other fertility centers in the region. So at Neocare Clinic and Fertility Center, we are able to offer a fairly comprehensive package that addresses all these fertility needs. The highest level of technology that we have is IVF. Okay, we are able to do the treatments, we are able to do the procedures, and we are able to do all the lab processes that are involved, and we have noticed a number of successes. This current mother that we're talking about is the first one to deliver. A number of them are currently pregnant and they have succeeded through this technology, and a number of others are still undergoing treatments. And apart from IVF or in-vitro fertilization, we also have other assisted techniques that we do offer. We have what we call artificial insemination, or IUI, which they call intrauterine insemination. This is where a woman is stimulated and eggs monitored, and on the day when the ovulation is likely to happen, we have the partner's sperms and we inject them directly into her womb. And in this case, fertilization takes place within her body, and the only technology that we are offering here is to inseminate her. And so many reasons again why we do this, especially if other methods of natural conception have failed. We also do ovulation induction for women who are not ovulating for one reason or another. There are several women who have good eggs but they cannot ovulate by their own, and those ones undergo ovulation induction and cycle monitoring, and we are able to do that as well. We also have surgeries that we do for purposes of maximizing conception chances. Some women come with fibroids. These are swellings in the uterus which we need to remove sometimes for them to be able to conceive. Some have scar tissues in their uterus, scar tissues in their tubes that we have to cut out sometimes. So we do all these range of surgeries. Even men may need surgeries for them to be able to recover their sperm production. We have men who may be unable to produce sperm simply because of a mechanical problem, or they have surgical conditions like hernias, like hydrocele, like varicocele, and we have a number of surgeons that do this. And with these surgeries, a number of men are able to recover. In addition to all these, we have a robust lab that is able to do a number of these investigations. All the causes of infertility that we listed are able to be assessed at Neocare, including the scanning, including the hormonal tests, sperm tests, and all these things are being done by high-level technology and well-trained health workers at Neocare. We also have counselors that are specializing in infertility. We know fertility treatments and being infertile is a distress. People need psychological and emotional support, and we have a dedicated team for this as well. So this is part of what Neocare offers. Although we also offer other non-fertility related services. We have gyne problems, women who have other problems that are non-fertility related. We do antenatal visits, we offer family planning methods, and so forth and so on. So the next episode you're about to watch is one of the stories of the successes that we've registered, that is going to share about her experience. Okay, and this will add more to what I've described. Thank you.
You're watching AIT TV, empowering you.
Nkazara umwana
makumyabiri. Then kuihobwe ndijo yabara abirahuye imyaka umwana ine myaka 10 njya n'imyaka 8. Then bwa nyuma kuna bire nindagiza aje wandangira Neocare Clinic and Fertility Center. Kuna shikireyo naganira n'abashaho kana mnonga ganira na Dr. Sembe kandi twaganire twashanga ntabasa kubaho uburyo bwo kutungonije umwana kandi uburyo bwo tukabukozesa kandi umwana tumutungire ni wogu nuncikiye aha arebeka umwana w'umwojo arubunda araha abantu bijya gushanga baryokwe muri bakwetenga abana ngo ushanga batakumanya ubundo byo kuba kubasa kubatunga ubunda kugira ngo batakushobora nigashimba batakugenda konka nani mbatero muranga kugira ngo kuwakura ibyo niyo clinic Fertility Center aho mu rembo rwa Mbarara ne yatanana na yabyamaka no basa kubashyikira muganire abo kwanyo ngiye cyo kureberaho kandi umwana mwenaha kandi ko natandikine nabo rahanga yabakoramo umwana namutunga kuko amashimerwa ni minji abo kubako kwano wetenge ikintu notamu ubundo tamwamani ushabarahanga kugira ngo rahanga ubuntu bari gukora byona acukura byoma so amashimerwa ni minji kandi kumbe nimbanyizire ka check up kwajya ngo ka stage mpora konja kushemererwa na hata hinyire baby amashimerwa mu wota level nka mutuma toka muri ko ngari ko ngabone minji munonga bundi nabasa kuburyo ko hariho nango nabindi kumanya konka bundo shanga waje tunacibona mwana konka twareba ngo nyonko kundi cyo kureberaho kandi umwana mutungire abako baryokwe binacetengwe cyo babasukika clinic jina gamba batungo buhabuzi batunge icyo bari kwetenga batamana no kushagurira narahanga bakozese akwesa n'abashahaba bakana narahanga mwe abahiro bwenjo kwanza nisima rahanga base kuri na kusiyo gwirove kandi ngaruka nsima abashahaba bakoze mu muhango munonga kandi uko nabeningane babaja ngo hazo sigara hanga kimwe sabantu sigara hanga wenu nyabona imbasima munonga abo babiri ba telekansaje bene bashemererwa bebinde customer care kandi bire na rukundo so ni mbashavuga ngo abako bari ni bije batakajya mu nashukuri tukuza isita kumanya nabona abantu bakwakira je nk'abantu kandi bakushemererwa kandi bakohereza ubuhabuzi sabo ndire bahora kugira ngo taronshonga nabona abantu bahumuza kandi rahanga nabakoramo ushanga twanenda wacu seko nubusima nasima rahanga nasima n'abashaho kandi nanye nimbura ko kwesima anye ninyasima ko warahanga kozere gukora mu magara ganje